The second group of techniques to alter breathing patterns involves promotion of the use of the accessory muscles of ventilation. These techniques are utilized when the diaphragm requires assistance. Patients with high-level lesions may require constant assistance from accessory muscles during wakeful hours, while patients with lower-level lesions may only require the assistance of these muscles when ventilatory demands increase. 4 techniques will now be presented which promote increased participation of the accessory muscles. When the diaphragm needs assistance and the patient has difficulty in recruiting accessory muscles, it may be appropriate to inhibit the diaphragm in order to indirectly promote active contraction of the accessory muscles. This is accomplished by slowly giving manual resistance to the diaphragm during inhalation.
Dana, do you feel how much your belly rises when you're breathing? I want to try to help you get your upper chest more involved in your breathing pattern so you can take a deeper breath in. I've asked you to raise your arms up above your head because that helps to facilitate your upper chest and taking part in the breathing. You'll feel a little bit of pressure with my hand down here by your abdomen, and I want you to try to be breathing with your upper chest. Good. A little more. That's it. See if you can do it a little bit more. That's it. Good. Slow your breathing down.
Note how the accessory muscles become more active as the inhibition becomes apparent.
Do you feel how much your chest is rising? I want you to try to think of that as I slowly release my pressure from your stomach.
A benefit of this technique is that it does not require the active participation of the patient. Therefore, it is appropriate for patients who are apprehensive or unable to follow verbal instructions. Similar inhibition can be achieved posturally by placing the patient in a prone on elbows position. Quadriplegic patients in this position have increased contact with the supporting surface compared to normals. This is due to their lack of active upper trunk extension. This surface contact results in postural inhibition of anterior and inferior excursion of the diaphragm. In this patient, note the spontaneous use of upper trunk accessory muscles. A final comment on this prone on elbows position: because the patient's weight causes passive inhibition of the diaphragm, the position can be anxiety-producing in early trials. The second technique used to promote accessory muscle function, the upper chest expansion technique, will be demonstrated in 2 variations.
Okay, George, what I want you thinking about is breathing into my hands because I'm going to work on getting you to breathe more with your upper chest. All righty? Mm-hmm. Take a nice easy breath in and blow it out. And breathe into my hand. Breathe in, breathe in, breathe in, and let it out.
The first variation, the upper chest stretch, promotes accessory muscle function which facilitates chest expansion in the anterior, superior, and lateral planes. It can be performed in either supine or prone on elbows positions.
Dana, we're going to do the same technique in prone on elbows. I want you to think of lifting your chest up and out towards me, and don't expect as much motion as we got into supine position. Start out with your head down. When I ask you to breathe in, you're going to lift your head up and raise your chest up towards me. Easy breath in first, and blow it out. Now breathe into my hand, breathe in, that's it, and blow it out. Breathe into my hand, breathe in, much better, and blow it out. Breathe into my hand, breathe in, that's what I want to see, good, blow it out.
Note the difference in how gravity would affect the accessory muscles in each posture.
George, give me your hands, bring them up behind your head. I want you to take a nice deep breath with me and bring your elbows up. That's it, hold it, and blow it out slow.
A second variation to increase chest expansion, often referred to as the butterfly maneuver, is performed in sitting.
And again, nice deep breath in. Blow it out slow. Look for control. Up slow. Blow it out slow.
The butterfly maneuver can also be performed with trunk rotation.
George, bring your arms back up again. This time we're going to do it with rotation. I want you to bring your shoulder back towards me and look up towards me. As you breathe in, then I want you to bring this right elbow down towards your knee and blow out. Bring your arm up. Breathe in, that's it. Blow out. Bring your arm up towards me. Way back, that's it. Blow out.
Note that extension of the upper trunk facilitates greater anterior excursion of the rib cage, facilitating participation of both intercostal and oblique abdominal muscle groups. Also note the increase in expiratory potential provided by the butterfly maneuver. It is therefore effective for improving the decreased ventilatory reserves found in most spinal cord patients. The third technique for promoting accessory muscle function, lateral chest expansion, is begun in supine and can be progressed to working in side lying.
George, I want you to concentrate on breathing down in your lower chest. I want you to concentrate on having the air fill up right into my hands, all right? Take an easy breath in and let it out. And breathe into my hands. Breathe in, breathe in. Real nice, let it out. And breathe into my hands. Breathe in, real nice, let it out.
In addition to promoting diaphragmatic function as shown earlier, the lateral chest expansion technique primarily facilitates the lateral intercostals in paraplegics, and this can be performed in the lower and mid-chest regions.